the financing of the healthcare and the organization and quality of the healthcare. Starting with the financing of the healthcare, you have to realize that 25% of this community is not insured. There is no healthcare financing system that can carry the weight of 25% of the populace not being insured. You have to be realistic in that. But we have to, if we want to do something with that 25%, we will have to focus on reorganizing our immigration first, because we have a too big load of undocumented persons in this community, and I see it when I'm on a weekly basis on call. You see those that are not documented, no insurance, they get themselves in troubles, in a car accident, in a fight, whatever, they get sick, they come to the hospital. I'm not going to deny them the care. I'm going to care for them as I do it for every person here on the island, but at the end of the day, that bill is not going to be paid. You have to realize that. Very good. Secondly, Andrew, we have to start thinking on a system that makes it financially sustainable. We have been using the general health insurance as the formula that is going to make it happen. I can tell you it's not going to happen, and I will tell you why. That formula, we want to use it as a general concept that will solve the problem of St. Maarten. It's one formula and it will pay for everything. That's not true. I think before getting to a national general health insurance, that I think will not be possible for country St. Maarten. If you want, I can explain you that too. We have to just start tweaking what we have now instead of trying to make an aggressive discovery of a formula like a general health insurance that is not going to work with this island. First of all, we have three big groups when we start talking about covering the finance for the care. The first one is we have the lower class that have their challenges financially. We have a huge middle class, and nowadays the SVB have expanded that from 67,000 per year income till a bracket of 120,000, and you have those, the halves, that they can take care of themselves. But in the middle group, we have also the OZR group, and that is politically a very, very sensitive group. And in the OZR, you have the civil servants and the PP card holders. But the OZR is the one that is covering healthcare for the civil servants. But this OZR that is doing that is not a healthcare insurance model to cover for the civil servants. What they do is just a contribution to their healthcare. It's not a well-thought formula that is going to cover. So first of all, the contribution of civil servants in the OZR for their healthcare is 2%. But the SVB, if you have a private business, you have a business and you insure your employees, the employees are going to pay 4.2%, and you are going to pay 8.3% as contribution to their premiums.